Federal Bank and News 18 Network present Sanjeevani, United Against Cancer. Knowledge partner Tata Trusts.
Nestled in the heart of Mumbai is the newly opened Head and Neck Cancer Institute of India, or HNCII. The 93-bed facility, started by the renowned cancer surgeon Dr. Sultan Pradhan, a doctor with 50 years of experience in the field of oncology, is dedicated to providing comprehensive and cost-effective cancer care for head and neck and women's cancers. Remember, India has one of the highest rates of head and neck cancer in the world, making up 27.5% of all cancers in India versus just 4% in the West. The hospital, developed through public-private partnership with the MCGM, cost a total of 250 crores, has been entirely funded by patients and philanthropists, with major contributions from the likes of the Narottam Sexaria Foundation, Jamshed G. Tata Trust, HDFC, Kiran Mazumdar Shaw, foundations by Cipla, Azim Premji, Mahindra and DMart, amongst others. The aim of the hospital, that started operations this Independence Day, is to provide cancer care at reasonable rates. Hence has aligned its charges with Tata Memorial Centre and will be subsidizing care to the economically weaker sections of society. The hospital till date has completed 600 treatment procedures and over 5,000 patient consults. To talk more about the hospital, the vision, we have with us the respected and renowned Dr. Sultan Pradhan and his student and mentee, surgeon and director of the institute, Dr. Prathamesh Pai. Dr. Pradhan, Dr. Pai, thank you very much for taking the time out. Dr. Pradhan, let me start with you. If you could just give us a brief in terms of where we are and what was the vision behind the hospital.
The institute was built because head and neck cancer, that is the mouth and throat cancer, is India's most common cancer. And until a few years ago, it was also the least attended to cancer. And we started off addressing just this one cancer. And we want to be just specialists in one cancer, head and neck cancer, because it is really India's #1 cancer. So while every facility is available in this institute, and we also treat women's cancers, we want to specialize in head and neck cancer. And not only for treatment of cancer in this place, but addressing the needs of the nation in training people in head and neck cancer, because really we are lagging far behind developing expertise in treating this cancer. Though much is happening in recent years, there is a lot more to do. So this institute needs to do not only treating patients here within the institute, but also develop more human resources, develop more ENT surgeons getting interested in head and neck cancer and treating them, and developing departments of head and neck oncology within the public hospitals attached to our medical colleges. Only then can we address this problem in India. And for all this to happen, there has to be an institute that will run this program. There has to be an institute that will transcend people and transcend time. People will come and go. That is the vision that we have. Dr. Pai and I both share that vision.
So Dr. Pai is the medical director of the hospital. So Dr. Pai, you would probably be in a better position to tell us about the kind of services which are being offered at the hospital, as well as the kind of technologies available.
Ekta, you know that the head and neck cancer is the most common cancer in the country. And we have patients coming to us in advanced stages, and for which we need the basic infrastructure. And that is inadequate in our country. The government is also doing its bit, but across the country, when you have such large number of head and neck cancers, we need to increase the infrastructure. And that's what Dr. Pradhan's dream has been, to improve the infrastructure and provide the care for the head and neck cancer patients. So we have got the state-of-the-art operating theaters and the entire comprehensive care facility, which includes radiation therapy, medical oncology, and radiology and pathology. Pathology is a backbone. So our institute will provide the state-of-the-art ability to diagnose these cancers. And now we know so much more about these in terms of the molecular pathology, immunohistochemistry, all that will be provided at our center. In terms of surgery, we have all the facilities required to provide the state-of-the-art care. We are not only doing the basic surgical procedures, we are also doing things to improve the quality of life. We are doing minimal access surgeries with the help of lasers. With the endoscope, we are doing skull-based surgery. We have the ability to improve the treatment by providing navigation, by providing intraoperative nerve monitoring, providing the state-of-the-art facility to do drills and the cutting instruments required to reduce the trauma to the patient. So with these kind of facilities available, we can improve the quality of care, we can improve their outcomes, faster recovery, and so that more patients can be treated in the same facility.
Okay. So, Dr. Pradhan, the USP of this particular hospital, which has been modeled a lot around what Tata does, is affordable care. And we, in fact, are in an area where you have patients who are here for free consultation as well. So, tell us about the rates of the hospital, the affordable aspect of it.
So, when I first envisioned this hospital, I did not want it to be not only not a corporate hospital, but not even any other private hospital. I wanted to model it along the Tata Memorial lines. And the first thing that I said for myself and for my board is that we will peg our charges at the Tata Memorial charges prevailing at that time. That is the first thing that I set for myself and for the Board of Trustees. They are facing that challenge, but they are facing it well. They are solving the problems. But some things, when we do not want to compromise. Otherwise, there is no end. You look at sustainability and you completely lose sight of affordability. Sort of affordability has to be looked at, and no one has done it better than the Tata Memorial has done.
But how exactly are you doing it? Because that's the challenge: affordability, sustainability, and medical inflation, which is in double digits, around 14% odd. So, given all of those challenges, how are you managing to maintain your rates to allow affordable care?
So we are having the facilities for providing the state-of-the-art care for the indigent population as well as the affording. So when the model works with the patients being provided the care at affordable rates, using the services optimally. So optimization of your services and the use of proper equipments so that we can provide the same care and not compromise on the outcomes is the way forward. And we have tried to strike a balance between the equipments that we are having on board to provide the same care. So we need to, like Sir said, it is a challenge. We will need to seek a lot of philanthropy. We will need to treat the patients who are not affording, which are in larger numbers. And we need to have a model wherein the patients pay for it along with, so that there's a co-payment, so that we have welfare supporting them, as well as the patients are going to will pay from their pockets as well.
So, what are the trends that you're seeing in the hospital right now? Because one of the big trends emerging in India is also medical tourism. There are patients who come in from Bangladesh, especially for oncology treatment, other geographies close to India. Are you seeing that take place here?
Of course. And we need to inform you that we do not, differentiate between any of our neighbors. So the SAARC countries will be provided care at the same rates. So that's going to be our challenge and also our service to our people. So the patients coming from Bangladesh, from the Middle East, and across in Nepal and from Sri Lanka, they'll be provided care at the same rates.
Can you give us an example of, or just illustrate to us, how exactly does it work when a patient who cannot afford care wants to access care here?
Certainly.
Yeah.
So the patients, when they come in, they are made aware of all the facilities, and they need to provide us certain documentation that will tell us that they can actually avail all the welfare that we have in the hospital. So all the documentation where we will find out what is their occupation, how much do they earn, what is their family strength, because it's not just the affordability. If they have a larger family, then sustenance of that is difficult. And in cancer, you need to realize that the first treatment is not the only treatment. You may have subsequent recurrences, and the patient needs and the family needs to plan for that. So all that our medical social worker will take into account. And once the patient is evaluated carefully, thereafter our medical superintendent, the trustees, the board of trustees provide a lot of welfare.
So one of the key points about cancer care has been an infrastructure to support the patient as well, where you have long stays, you need food which is affordable, stay which is affordable. How are you providing holistic care to the patient and the family?
So the in-house facilities are provided for the food and the stay for the patient and the relative, and the hospital has negotiated a good deal with a lot of these providers so that we can provide them at very affordable rates.
You've done around 600 operations till now, 5,000 consultations. You all started in August of this year on Independence Day. How much is the scale right now? Where do you see occupancies increase? What is the kind of up move that you're seeing in these numbers?
So we have, in the last 4 months that we have begun, increased the occupancy of the hospital, and we have reached more than 50% occupancy as of now in less than 4 months. So we know that there is a large need in the country, and we will soon be inundated with work. So we are going to increase our medical staffing so that we can provide more care to the patients. And we are looking forward to training more people. Like Dr. Pradhan said, we would want to encourage people coming from across the country.
Okay, all right. Well, we have more questions, but we're going to move into another part of the hospital to really showcase the hospital and quiz Dr. Pai as well as Dr. Pradhan with a few more questions. Stay tuned.
Federal Bank and News 18 Network present Sanjeevani, United Against Cancer. Knowledge partner, Tata Trusts.
Dr. Pradhan, Dr. Pai mentioned earlier the challenges of running a hospital, the fact that you all want to focus a lot on affordable care. In your opinion, would you concur, would that be the biggest challenge that you are facing when it comes to running this particular hospital, that you don't want to deny anybody care and you want it to be an equitable place for care?
In my opinion, this hospital has been well planned, including the pricing structure. It was not a decision that was made without thought being put into it. I knew that the rates at the Tata Memorial are proper, and an institution can be a sustainable institution if those rates are kept. Over and above that, when we have to give welfare, over and above that, we need to bring in welfare. Otherwise, I think that is the right pricing. And for this country, we have done so many things at affordable pricing in this country. Look at Chandrayaan and Mars. Look how we have done it. This hospital can be run. It is not a thought, it is not something that enough thought has not been put into. But the country has no insurance. People do not have insurance. When they come in, we want to give them, and that the philanthropy will support it. And philanthropy is willing to support. When they see good work, they want to support it. So I don't find that as a challenge. Right now, the challenge that I have is we need accommodation for patients' relatives. Patients come from all across the country. A lot of the northern states, the northeast states, patients come here in huge numbers. Where do they have a place to stay? And I want to have a decent accommodation for them.
Tell us a little bit about the team that you have. Is it primarily from Bombay?
One of the best things about this hospital is that I've got a wonderful medical team. Wonderful medical team. You see the pathologist here. You see these head and neck surgeons that we have. Prathamesh was my student, but now he's a master. He's in India. You have none better than Prathamesh. So, like there is a saying, "Child is the father of the man." I have to learn from him nowadays. He's so good, so very good. Also, my other head and neck surgeons here, they're so good. So, what I'm really proud of is not the beautiful facility that we have built, but the beautiful people that I have here with me. Beautiful people. The best in the country, they're here.
What about this burden of oncology that India faces?
That this institution is committed to preventive oncology. And in preventive oncology, we have tied up with the Salam Bombay Foundation. And you may have heard about the work that Salam Bombay Foundation has done in educating the school children, the municipal school children. Tens of thousands of children have been trained to quit tobacco, and their talents have been harnessed. And we are with them into this preventive oncology. Then this hospital is also there in palliative care with the Cipla Foundation. They have done remarkable work in palliative care, and whatever we do, there will be patients who will fail this treatment and will need palliative care. And we have tied up with the Cipla Foundation, who are here in-house. They're providing palliative care in-house. Pain management is being done in-house. And Prathamesh is overseeing all those developments.
So, as a head and neck cancer surgeon, what would your key message be to everybody who's watching this?
All I can say is that it is a highly preventable cancer if we adopt healthier lifestyles. And tobacco and alcohol, we have to train our children to see that they don't take to that habit. Number two, it is an eminently curable cancer if detected early. You only have to look into the mouth and detect it. It is easier than detecting breast cancer early. Just have to look into the mouth, and a health worker will be able to do that. And we are doing that. We are reaching out into the communities also. So two of the things that we have to do is prevent by adopting healthier lifestyles and detect them early and treat them early. And the third thing that I would want to tell, please have health insurance. Please have health. It is not enough to detect it early if you cannot go for treatment early. So you have to do these three things. These are the three messages that I would like to give. Prathamesh, you would agree with me?
No, I agree with you wholly, sir. This is the biggest problem that we are facing, that the patients don't have health insurance. And then they are causing a financial burden on the family. So they'll be financially bankrupt by the time they are treated. And we need to understand that this can be a recurring expenditure.
And that also ties in with late detection, especially for women's cancers, where they just get too busy to care for themselves. What is the message that you would probably want to give out on that front?
So early detection is the key to any cancer treatment and prevention. And we would urge all men and women to look at themselves critically beyond a certain age, look at symptoms, and if there are symptoms, not to hide it, not to suppress it, and go and meet a physician. There's an average delay of 6 months from the time the patient has a symptom and gets detected. And we have lost a lot in that period. You need to understand the cells are doubling at day to day, and by the time the patient comes to us, they are in advanced stages. So though we may do the best that we can, it'll fall short. So if you can detect it early, the treatments are lesser, the costs of the treatment are lesser. And that is very important to realize. Our burden increases as we detect them late.
Dr. Pradhan, what would your thoughts be on late detection, and how critical is it in terms of prevention of any kind of advanced cancer?
So it is very unfortunate that cancers that can be so easily detected at an early stage, we are detecting them in stages 3 and 4. It is so very unfortunate that what can be easily detected at stage 1 and 2, when the cure rates are of the order of 80 and 90%, are being detected at stages 3 and 4, when the cure rates are much, much lower, when the treatments are far more drastic, far more expensive. Today, everywhere in surgery, in all regional specialties, what is really the real advance is we have conservation trends. So if you detect a cancer early, then the jaw doesn't need to be sacrificed. If you detect a cancer early, the larynx, the voice box doesn't need to be sacrificed. But they come at such a late stage that we have no option but to just sacrifice that. If you detect a breast cancer early, the breast can be preserved. But women will not come forth. My son has to appear for a 12th standard exam, so she keeps mum. My husband has this health problem, let him get well, then I will come. 6, 8, 9 months have gone by. This is not an exception. This is really the rule in this country. It's so unfortunate. Cancer will not wait. Cancer will not wait. Like Prathamesh said, it just cells keep doubling all the time. And we just lose out there. So this is the most important message that I would like to convey to people. Please don't wait. Come early. Get treated early.
Okay, all right. On that optimistic note, Dr. Pai as well as Dr. Pradhan, thank you very much for taking the time out and congratulations on this facility and all the good work that you all are doing. Thank you very much.
Thank you.
Federal Bank and News 18 Network present Sanjeevani, United Against Cancer. Knowledge partner, Tata Trusts.